right, so hello everyone, and welcome to Division 46 of the American Psychological Association, the Society for Media, Psychology, and Technology. I'm Don Grant. I'm a past D46 president, and I am currently on the executive board. And I am so excited to introduce you all to today's topic and speaker. The topic of today's webinar is movies and mental illness. And we're joined today by Dr. Danny Wedding, PhD, MPH, who is arguably the world's leading expert on the portrayal of psychopathology in cinema. He is so prolific. I mean, Danny is one of my heroes. He's someone that when I came into the division, I looked up to and I said, "Oh my goodness, these people in this division are incredible." And Danny is just, I mean, he doesn't stop. He writes books about movies. He reviews psychologically relevant films for the Hogrefe Spotlight series. He lectures on movies around the world. So here's some of his credentials, which just wait, there's a lot. Dr. Wedding got his PhD from the University of Hawaii. He did his postdoc at the University of Mississippi Medical Center. He was awarded not one, but two, little extra, Danny, but two congressional fellowships. I mean, just to get one of those, if anyone knows, is impossible. Daddy got two, one in the Senate and one in the House of Representatives. He's written and published 14 books, three of them on movies. He's a past president of APA Division 46, which is ours, and 52, which is the Society for International Psychology. Now, Dr. Wedding is a self-confessed longtime cinephile. He watches 2 to 3 movies a week. And this interest, combined with his clinical psychology training, eventually resulted in 5 editions of Movies and Mental Illness. This book, if you have not gotten it, I strongly encourage you, get this book. So it's on number 5. 2 editions also of Positive Psychology at the Movies and a book in press, Movies, Miniseries, and Multiculturalism. All right, it's a fun fact. Dr. Wedding, I call him Danny, Dr. Wedding has taught in 2 Caribbean medical schools in Antigua and St. Martin. Impressive fact. If that wasn't enough, Dr. Wedding completed Fulbrights in Thailand and South Korea and directed graduate programs in Hong Kong, Tokyo, and Mexico City. I mean, it's incredible. I am so honored and so privileged that I was asked to introduce someone that I look up to and have with such respect. And I also want to give a shout out to Jennifer Van Gore, D46 webinar producer extraordinaire, our force behind the scenes. Thank you so much, Jennifer. And I want to welcome and thank all of you because you're certainly in for a treat. So sit back, grab some popcorn, and let's go to the movies with Dr. Danny Wedding.
Thank you, Don. Gee, I'm delighted to be here, and I'm pleased and proud to be an active member of Division 46. It's sort of my APA home, and as those of you who are members know, there's some incredible people in the division, and they are active, they do things, they just do more than just talk about things. So it's been a real joy for me to belong to the division and be part of it. So I'm delighted to talk about movies in general at every opportunity. And in particular, I'm going to talk about the first book on your left, Movies and Mental Illness, which was the first book that I wrote about movies along with some colleagues. So I hope this is interesting and relevant. So some of you might be familiar with the first book that I did with Ray Corsini called Current Psychotherapies. It's been around since 1960. And John Norcross and I are starting to work on the 12th edition of this book. But I'm neurotic enough that when I went to the movies, I would always take notes. And those notes eventually got larger and larger and at one point turned into a book. And I taught at Marshall University in Huntington, West Virginia. And one of my jobs was serving as chief psychologist at the Huntington State Hospital, once known as the West Virginia Asylum for Incurables. And I had a colleague there, a nurse, Marianne Boyd, and she and I were both cinephiles. And every Monday we would have lunch together and inevitably talk about the films that we had seen over the weekend. And those conversations grew into our first book, Movies and Mental Illness, using films to understand psychopathology. So it was a slender volume, but it was great fun to work with Marianne on the book. And you probably recognize this film, As Good as It Gets, Jack Nicholson. We had to pay Jack Nicholson $300 to use his image on the cover of the book. And when the second edition came out, we got Russell Crowe's image, and we had to pay Russell Crowe $1,000 to use his image on the cover of the book. And by the time the third edition came around, we decided we couldn't keep paying celebrities, so we got a depressed teenager just to bend over. We took a silhouette, and that became the cover of the third edition. And we've played with various themes through each successive edition. So one of the things about writing about movies is that you constantly have to be updating your books. New films come out and important films come out, and they have to be discussed. So I've always wanted to be a movie critic, and one of the things that I've been able to do through Hogrefe is to review psychologically relevant films, and these are the four we've done so far. I hope to continue to do this. I think all four are remarkable films, and if you haven't seen these, I would encourage you to. I think you'll find them to be psychologically relevant. For 14 years, I was the editor of APA's Journal of Book and Film Reviews called Psych Critiques, and E.G. Boring, over 100 years ago, set up the journal, which was then called Contemporary Psychology, and Boring Boring included film reviews along with book reviews. And then along the way, the practice of reviewing films was dropped. And I brought it back when I became the editor after Bob Sternberg's editorship. So it was a great honor for me. And one of the really nice things is that we reviewed a film every week, usually 10 books and one movie. And it's been great fun to work on the journal. And because the first book was pretty successful, Ryan Nemec and I got together and did a second book on positive psychology, and that was a lot of fun. And Ryan was a great collaborator. We discovered that we could talk about character strengths and virtues, a book by Peterson and Seligman, and use that as a springboard. And so we organized book number 2 around the Peterson and Seligman book, just like we'd set up Movies and Mental Illness according to DSM-4 at the time, and then later DSM-5. So you might be familiar with Peterson and Seligman's schema for looking at character strengths and virtues. The character strengths are the outer circle, the virtues are the middle circle, and these all lead to a life of pleasure, engagement, and meaning. So this was book number 3, the most recent one. It's out now. I had the pleasure of working with Lillian Gomez-Diaz and Raymond Abdul-Rahman, and so this book tries to use films as a springboard for looking at multiculturalism. So I learned a great deal by working on this book with my 2 colleagues. And although we haven't gotten rich off royalties, the movies books have opened up some great speaking gigs in Taiwan and in Nice, France, and in South Africa, and various places. So I've been grateful for that. And this is a talk that I gave when doing a Fulbright at Chiang Mai University School of Medicine. This was a Thai film, and I discovered that my students around the world loved movies, and many of them had watched films that I had watched, and English language movies are a major export. More recently, I've been working on international psychology. The book on the left was the first edition of the book done with Michael Stevens. The one on the right was done with Mary Bullock, Michael again, and Amanda Clinton, and it just came out, and we're pleased to have this come together. And we actually designed the cover for the first book, and I enjoyed that. That was a great exercise for us. But one of the things we discover is that around the world, psychologists watch movies and oftentimes are eager to talk about films and discuss them with colleagues. As Don mentioned, I taught for the School of Medicine at the American University of Antigua and then also the American University of the Caribbean. These were some of my medical students, and I discovered that I could have a meaningful session with my students by involving film clips. And so I've done this for 40 years or so. I've used film clips for introducing students, medical students and psychology students, to psychopathology. And with a class this large, it was much more effective simply to show clips to illustrate bipolar disorder or schizophrenia or any of the other mental illnesses that flesh is heir to. And the fact is that films sort of set our expectations about reality. TV does this, the media does it in general. So I show this to you, and most of viewers will see a couple embracing. But if I take this same slide to a third grade classroom and ask the students what they see dolphins. And if you look closely, you can see the head of a dolphin and the tail of a dolphin and the tail and the head and the head and the tail. And so they're nothing but dolphins because third graders don't have sexual experience to draw on in responding to this image. Likewise, when you see this slide, you notice immediately that it's upside down. Something is strange, and then you see it right side up, and it's horrid. And it's the same slide, but our brains tell us that this mouth is doing what a mouth should do. It's curved and it points up. And this mouth has been flipped, and it is hideous. So all of the books about movies have been translated into multiple languages, and these are Korean, German, Spanish, and Japanese translations. So we've been really pleased with how well the book has been received internationally. This is the Turkish translation, which I thought had a particularly attractive cover. And Hitchcock is one of those directors that I admire the most, and Alfred Hitchcock says that drama is simply life with the dull parts cut out, and that's the way I've always felt about movies. So one of the problems with films from a psychological point of view is that they stigmatize mental illness, and they result in stigma. And this is an example: Freddy Krueger from Nightmare on Elm Street. Freddy Krueger was conceived when a nun was locked in a hospital with a group of criminally insane men who proceeded to rape her. On a website, somebody remarked, "Freddy's the offspring of 1,000 maniacs." And this was somebody who knows almost nothing about psychopathology and even less about reproductive biology. This is what mental illness looks like. This is Andrea Yates. Some of you may remember reading about her a number of years ago. She drowned her 4 young children in a bathtub. She was quite psychotic, quite ill, and she's no Freddy Krueger, just a very ordinary person. But movies sometimes carry the theme that we have to be careful around people with mental illness, because they're dangerous and unpredictable. And if I can get this to work, I'm going to show you some clips. So the takeaway message is that people with mental illness are homicidal maniacs, that they're likely, when their illness is at its worst, to try to kill their wives and children. And it's a problematic message. And we also see in another film, Hannibal Lecter is somebody who is obviously mentally ill, and he is the quintessential example of a mental health professional with mental illness. So let's see if I can play part of this clip. Okay, I was so pleased when the film came out to realize that Hannibal Lecter was a psychiatrist and not a psychologist. And films like Henry, Portrait of a Serial Killer also carry that same message that Henry Lucas was mentally ill and went on to become a serial killer because of his mental illness. Otto Wall is a casual friend of mine. He's written a wonderful little book appropriate for those of us in media psychology called Media Madness. And he points out that while some people are dangerous, the vast majority aren't. Violence is seldom directed at strangers. The insanity fence hasn't resulted in lots of people being released. And the portrayal of mental illness in the media is highly inaccurate. And yet films can also educate the public. We find that Jack Nicholson's character in As Good as It Gets taught a lot of Americans about the reality of mental illness. And I don't really have time to show you that clip, so I'm going to move on. Likewise, with depression, Nicole Kidman earned an Academy Award for her role as the tormented Virginia Woolf in a movie, The Hours. If you haven't seen it, I recommend it highly. And Virginia Woolf, who, as you know, committed suicide, was really quite ill and wound up taking her own life. And I think that the film nicely illustrates what depression looks like. And of course, she committed suicide by putting rocks in her pocket and wading out into a river and drowning. House of Sand and Fog is another wonderful movie with Jennifer Connelly and Ben Kingsley that can be used to introduce students to the realities of depression. So Jennifer Connelly nails what depressed affect looks like in the film. Sometimes I'm asked, what's the best film to illustrate schizophrenia? And I typically recommend an old movie called Clean Shaven. It's a Canadian film, and it really is very powerful and does a nice job of presenting schizophrenia. And of course, I found that anywhere I go in the world, there are people who want to talk about A Beautiful Mind and what they got right and what they got wrong. And so I've lectured about this film. I've had an opportunity to be on a panel with Sylvia Nasser, and she talked about the movie, and I talked about the psychopathology behind the film. And the film's been endorsed by NAMI and organizations like that. I think that they do a really remarkable job of educating the public. There's some things that Ron Howard gets wrong in the film. He depicts visual hallucinations that are far more dramatic than those that occur in most cases of schizophrenia. And of course, as you know, auditory hallucinations are far more common than visual hallucinations in schizophrenia. But the movie also doesn't address the genetics of schizophrenia. And as you know, there's a strong genetic loading. And in fact, John Nash's son is really quite ill with schizophrenia and is sicker than his father ever was. A more recent film looking at schizophrenia is Words on Bathroom Walls. I think it's a powerful film. I don't have time to really show you clips, but it's a film that's worth seeing. But again, it conveys some things that are inaccurate about schizophrenia. It reinforces the idea that visual hallucinations are common. The hallucinations that the protagonist experiences are far more dramatic than those that are typically found with schizophrenia. And the film suggests that Words on Bathroom Walls, the film suggests that love is sufficient to conquer schizophrenia, and of course we know that it's not. So there's some themes that you get from films. One is that the presumption that there's always traumatic etiology. And you see this in films like The Fisher King. It's an old movie, but it's very dramatic. There are visual hallucinations that are very uncharacteristic for mental illness. Another myth that comes up repeatedly is that of the schizophrenic parent, this idea that parents cause their children to become mentally ill or autistic. And you see this in a film like Shine, a movie about the life of the pianist David Heftglot. It's a very powerful film. If you haven't seen it, you need to. But the film suggests that David Heftglot's father is what caused him to become mentally ill. See it if you can. Another myth is that harmless eccentricity is labeled mental illness and inappropriately treated. And I think you see this most dramatically in Cuckoo's Nest. Wonderful film. It got the top 5 awards at the Academy Award. And Randall P. McMurphy is an unforgettable character, as is Nurse Ratched. The American Film Institute lists the top 50 heroes and villains, and it's interesting that Nurse Ratched is number 5 on the list, and Hannibal Lecter is number 1. This is a fun scene. Let me show you a short clip, a classic scene from a classic movie. The psychiatrist in One Flew Over the Cuckoo's Nest is actually the superintendent. He was the superintendent of Oregon State Hospital, where the movie was made. Another recurring theme is that love alone is sufficient to conquer mental illness, and you see this in a movie like Benny and June with Johnny Depp. At the end of the film, Benny and June get together, they become a couple, they are in love, and the movie ends with a suggestion that everything's going to be okay because of their love. And life is simply not like that. So June is quite mentally ill. She's schizophrenic, and she's probably going to be struggling with that for the rest of her life. Silver Linings Playbook, great movie. If you haven't seen it, I want you to. Jennifer Lawrence got the Academy Award for Best Actress for this film. And here's a classic film, Fatal Attraction. When I lecture on borderline personality disorder, I sometimes show clips from this film. I think it's a nice illustration. My friend Marsha Linehan has said that people with borderline personality are kind of like those people with third-degree burns. Lacking emotional skin, they feel agony at the slightest touch or movement. And there's so many movies I would like to talk to you about. My friend Michael Roberts worked up this slide for me where he's got me filling in for Mr. Roberts. I was in the Navy Reserves for many, many years. Another film that has educated the public about mental retardation and autism is Dustin Hoffman's wonderful film dealing with the life and the story of Kim Peek, who had autism. It's a powerful film, and it's one that I recommend to you. It did a good job of educating the public about autism and pointing out that autism is distinct from mental illness. There are lots of films that illustrate dementia and Alzheimer's and the problems that caregivers confront in dealing with those. I particularly recommend The Father to you. Wonderful casting. So in the book, we rate about 1,500 films, and I've been doing this for about 30 years, so I've got a large database, and we try to go through, and some films are mentioned, but they're simply not worth the time of a mental health professional watching them. But then there's some that are highly recommended, and like The Aviator and Adaptation. Another myth that comes up is that somehow schizophrenia is the same as split personality, and they're just examples of dissociative identity disorder. And of course, schizophrenia is very different than dissociative identity disorder, but films like Me, Myself, and Irene confuse the two, as we see Jim Carrey going from gentle to mental. I miss Robin Williams. I'm sure you do too. He plays a psychologist. And The Soloist is another film looking at, based on a true story, looking at schizophrenia and the life of Nathaniel Ayres, who trained at Juilliard, but wound up living on the street and being quite ill. Lots of films illustrate bipolar disorder. Lust for Life is an old film with Kirk Douglas about the life of Vincent van Gogh. And one of my favorites all time is Michael Clayton. Okay, just a few comments about how psychiatrists and psychologists are portrayed in films. These are all films that were reviewed in Psych Critiques. They all present mental health professionals in one way or another. You might recognize What About Bob and The Top Sinner. Happiness is a film about a psychiatrist who's also a pedophile. Tin Cup is a remarkable movie. I think that any of these you would enjoy. When psychologists and psychiatrists are portrayed in films, they are typically portrayed in one of 5 ways. In a movie like Psycho, the psychiatrist is the expert who has inside knowledge. In What About Bob, you see an ineffectual and arrogant psychologist. Oftentimes we're portrayed as seductive and unethical, like in the movie Tin Cup, dangerous, like in Silence of the Lamb and Dressed to Kill, or sometimes kindly and well-intentioned, like Ordinary People and Good Will Hunting. In Good Will Hunting, it's interesting to see the mise en scene, the background that they present. And if you there's one scene where Matt Damon's character is pushed against the wall by Robin Williams, pushed against the bookcase, and if you freeze that frame and blow it up, you can see that the books on the shelf, they actually deal with transactional analysis. I'm okay, you're okay, and things like that. Behavior modification is generally presented in a very negative way, and psychologists and psychiatrists are presented as demons. Okay, Prince of Tides, a Barbra Streisand film in which she plays a psychiatrist who has an affair with the brother of her patient. I've taught medical ethics for medical students for a number of years, and sometimes use the film to raise questions about the limits on ethical practice. Is it okay to have an affair with the brother of a patient, the nephew of a patient, a casual friend of a patient? And these are all questions that I ask my students to grapple with. These are all films that were reviewed in Psych Critiques. We reviewed over 700 while I was editor, and so I got to read every one of those reviews. One of my favorite reviews was of the film The Aviator, and I got Ray Fowler to review the film. And you might know that Ray Fowler, in addition to being Chief Executive Officer and past President of the American Psychological Association, was also a person who did a psychological autopsy on Howard Hughes. And so he was probably the best person in the world to write this review. And Hughes was quite ill towards the end of his life. A more recent film is Horse Girl, about a woman with schizophrenia, I suspect. And Swallow, a film about a woman with an eating disorder. And Motherless Brooklyn, a film with Ed Norton. So here's a film that educates people about Tourette's. Motherless Brooklyn. Amour is a sensitive introduction to Alzheimer's disease and a loving husband and the struggles he copes with as he deals with his wife's illness. Melancholia, amazing film. I recommend it to you. I think that it's just one of the finest films I've seen illustrating depression. And I suspect many of you have seen Oppenheimer, a wonderful film. And Oppenheimer himself struggled with mental illness throughout his life. He was once diagnosed early on with dementia praecox, an older term for what we now call schizophrenia. And he does a superb job. Christopher Nolan is a wonderful director, and I recommend the film to you. Interestingly, Oppenheimer has actually presented an address at an APA convention, and his address titled Analogy in Science was published in the American Psychologist some years ago, over 100 years ago. So that's kind of what I had, and so I think that Jennifer wanted me to wrap up my comments by about 1:45 to leave some time for comments, reflections, questions from viewers. And Jennifer, can you tell me if we have anybody who's queued up to ask a question?
Yeah, thank you so much. That was I was making a list of all the movies I have to now watch. There's a lot of them. I will be busy. Yeah, so we have a few questions. I'll just read them in order as they came in. And you may have answered some of them already throughout the course of your presentation. So I'll just post them to you and do with them what you will.
Okay.
The first question is, what new movies have substantial psych content?
Yeah, Horse Girl would be one of the examples, and the newest film that came out last year, actually came out fairly recently, was Words on Bathroom Walls, and so that's one that I would recommend that people see. There are problems with it. It's a little bit overly dramatic. I don't think it's a perfect representation of what schizophrenia is like, but it's a sympathetic presentation, and you care about the young man in the film, and you get to see him coping with his illness with the support of his family and his love interest. Again, it carries that myth that love alone will conquer mental illness. He goes on to become a successful chef and a father. And I think the message is that you can have a disease like schizophrenia, but given support, many people who carry that diagnosis can have a rich, full, and meaningful life. So that's the most recent film that I've seen that I would recommend to members of the division, and I guess that's the one that comes immediately to mind. The Substance is a remarkable film, and if you haven't seen that, it deals with psychological themes about aging and loss of beauty and how people respond to that. So I found it really powerful and effective. So if you haven't seen The Substance, definitely go see it.
Awesome. Thank you. All right, we've got a few more questions. The next one is let's see, would movies in the same vein as the talented Mr. Rip or Talented Ripley or Twinless be applicable as movies depicting mental illness? Or would there be something different entirely?
Well, I guess there are relatively few films that deal with the general theme of mental illness. Films tend to deal with specific disorders like schizophrenia, like bipolar disorder, like dementia. And so there are lots of examples of those films. If you look at the book, it's geared to the DSM. So if you're interested in substance-related and addictive disorders, there are literally hundreds of films that deal with addiction in one form or another. And we talk about those. I don't know if it's possible, Jennifer, or if you have access to the email addresses for everybody participating with this film, with this video, with this webinar. But if you do, I can send everybody who's online copies of the appendix from the book, And so there are about 1,500 films, and they're all rated on that scale of 1 to 5 size. And I would be happy to share that with folks if you can get it out to them.
That would be great. Yeah, send it on over to me and
Good.
I'll distribute it out. Thank
Great.
you.
Sure thing. I'd be delighted to do that.
Cool. So, the next question is, are you of the opinion that films should depict mental conditions and mental health professionals accurately? Does it behoove them to do so?
Yeah, I would like to see them strive for accuracy, and I'm encouraged by the number of directors who are now bringing in mental health professionals to act as consultants on films. That was relatively rare at one time. Now it's relatively commonplace. When I became one of the deans at the California School of Professional Psychology, there are 6 campuses in California and 3 international campuses, and I was given the option of working at any one of the big 3 campuses of CSPP in LA or San Diego or San Francisco. I ultimately chose San Francisco, but I had fantasies that if I had picked LA, I could have had a part-time gig as a consultant to Hollywood about films.
Well, that's all right. So let's see. The next question here is, how do you feel about the use of horror movies that depict psychological issues in metaphorical ways? For example, Hereditary as generational trauma, Black Swan as mental breakdown slash self-destruction. Are they useful, or does the content need to be more straightforward to reduce harm?
You know, I think they are useful, and those are just amazing movies. Hereditary was incredible, and I will never forget the scene where a young woman puts her head outside the window of a moving car and is decapitated. It's just, it's etched into my brain. So I think horror can be a useful genre. It tends to be over the top. It tends to be unduly dramatic, but it is sometimes a stimulus for conversations. And so Black Swan is an example. I was dating a woman at the time, and we went to see the movie, and we walked out, and she said, "You're a psychologist. Explain that movie to me." And I was at a loss because it was profound, and it was a wonderful springboard for a meaningful conversation about what was going on in the movie, and what the characters were experiencing, and whether or not that was reality based. So I think that sometimes horror films can be really powerful. I have a friend who's a psychiatrist in Vermont, Steve Slosman, and he writes books about zombie films. He was a Harvard professor who was told that he shouldn't be wasting his time on zombie films, and he said, "Okay, I'll stop." And he said, the dean that he was talking to said, "Does this mean you're going to stop reviewing zombie films?" And he said, "No, it means that I'm going to stop teaching at Harvard." And so I've always respected Steve for that. In regard to the general question about balance, you know, I understand that directors, their first job is to tell a good story. And then after that, their second consideration might be accuracy and veracity of the film, but in general, I don't think we could expect too much from directors. I mean, Ron Howard is an amazing director, and so with A Beautiful Mind, he didn't get everything right, but he got most things right, and he produced a superb movie that will educate literally millions of people about the realities of schizophrenia, and it will convey the message that you can be brilliant and still have a very serious illness like schizophrenia.
We've got 3 more questions. We got 4 more questions. We'll see how much we can sneak in here. Okay, next question. How can movies be practically used in client work?
Well, great question. There's an emerging field of cinema therapy, and I've used bibliotherapy throughout my career, and I'd always have people read A New Guide to Rational Living by Albert Ellis, and so when I got to West Virginia, I discovered that I had some clients who were illiterate and who did not read books, and I did not want to embarrass them by assigning them something they couldn't do, but I could assign them films. And so there's an old movie about divorce called Kramer versus Kramer, an early Dustin Hoffman film, and if you have a couple who are struggling with divorce and parenting issues, watching that film might be a springboard for a meaningful therapeutic discussion. So I'm not sure that watching the film is going to change people all that much, but coming in and talking to a therapist about the movie would be useful. And so I've used films as a way of educating clients, and in particular, I found it useful to recommend films that parents can see to better understand their children's illness. And so if you have a teenager who's dealing with addiction, there are movies out there that deal with young people in addiction. And it's grist for the mill. Patients come in and they want to talk about the films and how the films relate to their own life. So I found it helpful, and there are a number of books that address cinema therapy, and it's a growing and an emerging area of interest. If I had to go back and do a master's thesis all over again, I might be writing about the use of films in psychotherapy.
The next question is, to what degree does art imitate life or life imitate art for mental illness?
Gee, um, I think it goes. I think it's bidirectional. It goes both ways, and so you find that many films uh, illustrate mental illness in an accurate and compelling way, and that's art imitating life. But then also you see examples of life imitating art. And so a recent film is One Battle After Another, and you can't watch that movie without thinking about the current political climate and people being murdered in Minnesota as they're trying to drive away from an ICE agent. So I do think it goes in both directions. It's a good question, and I'm not sure I have a great answer, but I think it does go in both directions clearly.
And working with middle school and high school students on mental health education, are there films you would recommend for that age group that gives a good understanding of teenage mental health?
Wow, there there are a Beautiful Boy is a movie that I think is very powerful and deals with teenage angst. Um, I guess what I do is encourage whoever asked that question to look at the appendix when they get it and see if there are films that they have seen that come to mind that might be useful. Um, my experience has been mainly with college students. And so I've taught undergraduates a few times in abnormal psychology courses, but more often I've been teaching medical students and psychology graduate students. And I find that films are inevitably well received. So if we have people watching who are teachers and you haven't incorporated films into your classes, you might want to think about it. I find that films are a wonderful springboard for class discussions. And so I haven't worked with teenagers in particular or with young people, certainly working with medical students, I've always found my students eager to talk about movies and to share their thoughts. And typically I would not tell them what they should think about a particular movie, but ask them to tell me what they thought, what kind of ideas came to mind as they saw the film. And it's ideal if I can find a movie that has a diagnosis that's ambiguous. Perhaps it's not clear if a character has bipolar disorder or schizophrenia. And so I might have two students debate that issue in the classroom, one citing all of the evidence in the film for schizophrenia and the other citing all the evidence for bipolar disorder.
All right, we're gonna try and get the last question in here, and then we'll wrap up. So the last question is, how do you feel about interpreting a film as an expression of a writer's or director's mind, which may also be influenced by mental illness?
Um, a poet once wrote that genius is to madness near allied, and thin partitions do their bounds divide. And I think there's some truth to that. I've been fascinated by the debate about the relationship between bipolar disorder and creativity, and I think there are writers and directors who have struggled with mental health issues in their own life, and that sometimes that is reflected in the books they write and the films they make. So I think in general, mental illness is an impediment to creativity. And even if you have creative ideas, oftentimes you don't have the energy or the volition to act on those creative ideas. So I think that as a rule, creativity is hampered and impaired by mental illness. But there are clearly examples. Wim Wenders comes to mind of directors who have struggled with their own mental health concerns over time. So those are great questions.